Hi, everybody. This is Dr. Ed Park from Recharge Biomedical. Today, we're going to be discussing acne. So, acne is a pretty ubiquitous part of being human. 90% of adolescents will have it. Even as we get older than 25, 54% of women and 40% of men will have it, and a lifetime prevalence of 85%. That's probably underreported because they just think, well, I get a zit. I don't really have acne per se. If we look at the chart above, we see that when boys and girls undergo puberty, they all pretty much get acne. In developed countries, it's slightly worse, perhaps because of improved nutrition and perhaps because of hormones in our food. Um, so the goals of the talk are to discuss who is affected, which we just did, what causes acne, preventions and treatments. We'll go over a case report and we'll talk about what the possible mechanism is. And this will be a pretty quick lecture today. What we see above are pictures of jargon or terms in dermatology. The first is comedones, which are just whiteheads. Although you have a mixture here, basically it's a clogged pore with sebum in it is a comedone. When the skin with the melanin gets oxidized, they become blackheads. That's why they're black. Papules are just, it's a medical term for bumps. Pustules are bumps with pus in them. Nodules are hard bumps. Cysts are bumps with fluid in them. Nodulocystic are bumpy, fluid-filled, mixed. Acne mechanica is like a mechanical irritation. And congoblat, it means making balls. So what causes acne? If we look at the cartoon in the middle center, uh, it kind of depicts it as a hair follicle, but to be true, or to be honest, the face really doesn't have all that many hairs on it, and that's face is a very common area. So we'll think of it more like a pore or a pilosebaceous unit. So in that cartoon, we see a couple of elements. We see the um, sebaceous gland, which makes the sebum. That's that sort of waxy, oily stuff in the skin. And then we see, of course, we discussed the whitehead. The blackhead is the oxidized melanin, pustule, cyst, papule, and nodule. It really doesn't matter that much. We're talking about an infection. So what causes acne? It's hormonally related. We know that because of the relationship to puberty. We know it because of the relationship to a woman's menstrual cycle. We know it because of weightlifters that take excess testosterone. So the hormones, especially the androgens, cause increased sebum secretion and gland hypertrophy. Dead skin also clogs up those pores, and then we get an infection. It used to be called Propiona bacteria because it made propionic acid. 4 years ago or 5 years ago, they changed it to um, Cutaneobacter acnes. But just because that's the main culprit, and when I say culprit, I mean that's what's present in the infection. It doesn't mean there aren't other bacteria, such as Staph epidermis. And once you get severely infected, you can get Staph aureus as well. So, what we see in that black and white micrograph is that there's a biofilm, there's uh, dead tissue, there's fibrous structures, there's sebum. It's like an apartment complex for bacteria in there, and it's hard to get out of that, hard to reverse. Uh, Part and parcel with the acne comes inflammation. And then over the long term, you get scarring and damage, and we can even get what's called ice pick scarring from tissue destruction, which we'll see. So, how does one prevent acne? Well, the main ways are to exfoliate and cleanse. You keep the dead skin cells from clogging up, and you keep the pores relatively open. Once you've got an infection, you want to avoid picking your face and spreading the infection and causing more inflammation. Stress, of course, is related to the immune system, and sleep also is a regenerator of the immune system. People who are maybe studying too hard and stressed out about school, that doesn't help. Uh, a commonly believed but hard to prove myth is that smoking or diet is there. As again, it's sort of a magical thinking. People say if I eat sugar or chocolate, maybe, but not directly. That's never been proven. So how would you prevent acne? Well, in the extreme, which are not recommended treatments, there are anti-androgens. The ultimate anti-androgen, of course, would be to castrate. And in the classical music era, they used to castrate boys to preserve their beautiful singing voices. Of course, this prevents the onset of puberty and male secondary sex characteristics. It's said that Michael Jackson was a castrati, also Wayne Newton, perhaps a castrati. We see above that there are four molecules. These all have 19 carbons. This is the steroid molecule. Uh, and in this flavor, we go from decreased to increased potency from DHEA, which is made in the kidneys of men and women, androstenediol, more potent testosterone, and then dihydrotestosterone, made by both men and women, uh, involved with things like libido, aggression, hair growth, male pattern baldness, and acne, as well as muscle maintenance. So, how is acne treated? Well, over the counter, there's billions of dollars worth of these products sold. The first is benzoyl peroxide. That is the old Oxy 10 or whatever. Everything over the counter pretty much uses either benzoyl peroxide or an AHA, which is alpha hydroxy acid. These are these tartaric acid, ascorbic acid, vitamin C, lactic acid, mandelic acid, glycolic acid. Glycolic, very common. This is also used in cosmetic derm for what's known as a chemical peel. And the thought is to exfoliate, to burn off chemically the superficial layer of skin, keep those pores relatively open. Of course, hormonal modulation is huge. Um, Again, for women, I was a practicing OBGYN. Birth control pills can often be helpful, despite the fact that they have an androgenic progestin. The When compared with the natural cycling, sometimes that can help decrease the overall level of male hormones and the severity of acne. Topical antibiotics are also a mainstay. Clindamycin and metronidazole are commonly placed gels or creams. Um, Oral antibiotics are the tetracycline family, including doxycycline. Got to be careful there. You can get a little photosensitivity from that. Um, Retinoids are vitamin A analogs, and they're very common. Also used in anti-aging. Retinoids tend to thin out the skin, and so these cause, again, less clogging, less dead skin accumulation, but they can cause redness and irritation as well. Perhaps not a mainstay of treatment. The ultimate retinoid is called Accutane, and above me we see the bubble pack, and on every single pill it warns you not to get pregnant. You have to be very, very careful because it causes birth defects. Finally, we have light therapies, which include sort of at-home light kits, and then also laser. Although the laser frequency somewhere in the 420 nanometer, it's very good at killing these bacteria. But I used to practice cosmetic laser as well. The treatment is somewhat effective, but not all that effective. It can be better after the acne has resolved to help revise some of the scars, and it can help to exfoliate, but again, not a quick fix. Accutane, very effective, but unfortunately, Accutane comes with a lot of side effects, perhaps psychological, but also GI, and the long term effects are in debate. Whether, I mean, it definitely works, it dries the skin out, but it's kind of a big gun, so to speak. So I want to talk about this case of a 17-year-old who had nodular cystic acne. You can see that for over a year he had moderate long-standing acne. And we would call this nodular cystic. It's hard to appreciate that, but before the treatment last year, you can see that there are these red, bumpy, nodular, infectious lesions all over the left and right cheeks. Um, this had failed some oral antibiotics, some topical treatments. Also done over-the-counter benzoyl peroxide, some of the acidic treatments. Also failed acupuncture, oriental medicine, and light therapy. So we decided to go ahead and do a treatment with 3 billion subcutaneous exosomes of mesenchymal stem cell origin into the nodular lesions. And then we microneedled, after, of course, numbing the face, microneedling to a depth of about 2.5 millimeters, introducing topically about 2 billion exosomes. And you can see 3 months after the first treatment, there's a real decrease in the redness, the inflammation, the infection, and the new lesions. Um, and that 3 month was when we did the second treatment. There was really no more nodules to inject, so we just did microneedling with 2.5 billion exosomes topically, and then also chose to do amnio to helpfully revise the scarring. At that point, there were only sparse micropapillar lesions. You can see here 9 months after just those two treatments that the skin is much better. There are very few lesions, and nicely, we didn't get the permanent sequelae of the ice pick scarring. When you get a prolonged damage, infection, inflammation, nodules, it actually eats away the substratum or the subcutaneous tissues, and you get a hole, which is known as an ice pick scar. And that can, of course, be with you for the rest of your life. So something about this seemed to prevent that phenomenon, which we're grateful for. Just as a way of reminder, because I don't know how many people have figured out what exosomes are, but just a brief recap. When we look at right down to the hydrogen atom, the Planck length, up to the giant sequoia, we see that size of these is on par with the HIV, the coronavirus. These are all 100 nanometer spheres. And in comparison, a bacteria is 10 times bigger than that. A human blood cell is 100 times bigger than that. And most of the cells in our body are around 2 to 600 times the diameter of these tiny little packages. They're not cells. They don't reproduce. They don't have any machinery. They don't have any DNA. It's all just proteins, mRNA, messenger RNA, and also microRNA, which are blocking messenger RNA. And they don't have self-antigens on the surface. So unlike stem cell treatments, they are not cleared by our immune system in a host versus graft reaction. So just finishing up, how would this work? Well, we have an antibacterial effect, which is not clearly understood by me, but the exosomes are antibacterial, it appears. They're anti-inflammatory. We know that quite clearly. It shifts the M1 macrophage type into M2. M1 is the inflammatory sort of pathway. They can rejuvenate damaged cells. So you have to imagine that in these pores, in these pilosebaceous units, there's so much work and reproduction and damage that it's almost like aging of the face. And maybe that's why acne goes away, because the face gets so damaged and the face ages out. But perhaps we're getting a rejuvenation of these cells so they can act younger and be less damaged and act less dysfunctional. And then finally, we get a filling in of the scarring and the M2 regeneration, laying down of new collagen. We see the famous actor Edward James Olmos. You can see that he must have had severe acne as an adolescent, because you have these ice pick scars in his face. And of course, this can affect someone's self-image and for life. And it's important that exosomes, in this case, possibly contributed to a decrease in the infection, the inflammation, and certainly the long-term scarring. So we're grateful about that. If you have any questions and you want to talk to me offline, you can email me at drpark@rechargebiomedical.com. And although this is a brief webinar, if you go to my website at rechargebiomedical.com, you'll see a plethora of information on a wide range of topics and links to my other videos. Danielle has a question. Will exosomes topically work as well? Yes, I think they would. But my rationale for using the microneedling was to get it a little deeper, 2.5 millimeters into the skin. But yes, absolutely they would work topically. And in fact, that's how they were given in the brochure. Features one of the founder's friends who had a third-degree burns of his face, and that's how he used them, was topically. Do I sell a topical? No, I do not. All my treatments have to be in person. We have to go through an informed consent. It's a patient-physician thing, so I can't just ship you topical exosomes. I guess I could, but ethically, I don't think that's proper. You can also have problems with handling. Not that you would, but they need to be kept at frozen temperature. Otherwise, they become useless. Much like the coronavirus and the coronavirus vaccine. It's the same technology at room temperature. They quickly the protective sphere quickly dissolves, and these things are rendered melted ice cream mush. Anyway, all right, I'm gonna get to my other salt mine tasks here, and I will hopefully see you all again next week. All right, thank you, Dr. Ed Park, signing off. Take care. Bye bye.